Hi, my name is Ollie and I'm a clinical pharmacist at an acute NHS trust. Hugh has asked me to put this little video together to give you some ideas about how to pray for the NHS at this time of the coronavirus pandemic. I think there are three main areas that you can pray for over the coming weeks. First of all, is to pray for our patients and their families. For the vast majority of us, the reason we do what we do is because we want to help others. So please pray for those in our care. Pray that they would get better and recover regardless of what has brought them in. Pray for their loved ones, those who are worried for them, not able to visit them in hospital. Pray that we as staff members can provide the best care that we can for them, especially at this difficult time. Personally, I can't imagine what it's like to be admitted to a hospital at the moment. So please join me in praying for those patients and families who are hit hardest at this time, physically, mentally, spiritually. The second way to pray for the NHS is to pray for all those in leadership positions, both nationally and locally. Pray for those at a national level making the hardest decisions about resources, how to support the nation through this difficult time. Pray for the leaders of the NHS in England, Scotland, Wales, Northern Ireland. Pray for the Department of Health, Public Health England, NHS Digital, NHS Improvement, the professional regulators and support bodies. Pray for the chief executives and leadership teams of NHS trusts, including the ambulance trusts. Pray for their ability to see and enact the support their staff and patients need, and provide a clear lead to all those who look to them. Pray too for leaders of each department and section of the NHS on the ground. Many are working well and above their usual hours, coming in at weekends, spending their evenings working from home. Pray for patience and the ability to think clearly, to plan, action and change in this rapidly evolving environment. Pray that despite their own exhaustion, they would be able to support their staff and to complete their own work on the front line as well. Finally, pray for all those who are working in the NHS at the moment. There are so many jobs and professions that are involved in supporting and running health services in inpatient settings, community settings, and the NHS as a whole. The list is endless, but here's a few examples of roles that you can pray for. Doctors, nurses, pharmacists, occupational therapists, physios, healthcare assistants, speech and language therapists, laboratory staff, ambulance staff, ward clerks, catering staff, 999 and 111 call handlers, administrators, porters, maintenance staff, radiology staff, phlebotomists, volunteers. There's so many more. The staff of the NHS are facing the hardest time in living memory. Many are becoming exhausted due to the sheer number of hours, the level of physical, mental, spiritual effort required to face each day, and then to deal with the situations as they arise. Some are staying in hotels to protect their loved ones, knowing that they put themselves at risk every single day. For some, they're at the end of their endurance. Pray for them. Some have witnessed the death of patients who seemingly had so much of a future ahead of them. Pray for them. Some are celebrating as they watch patients be discharged who are seemingly moments from death. Pray for them. Some are just putting on a brave face and carrying on as if nothing is happening. Pray for them. There are many coping strategies, from the stiff upper lip approach to the laughter and joy of those trying to keep positive, to those for whom the tears just need to come out. The aftermath of this pandemic is likely to be where many of the emotions kept under wraps for so long come to the fore. Please pray for the mental and physical health and well-being of all those working in the NHS. especially once the pandemic draws to an end. In amongst the pandemic, the usual heart attacks, falls and other emergencies still occur. Pray for all those doing their normal job, and also for those who have been asked to change role or to help in unfamiliar environments. In summary, there are three main ways that you can pray for the NHS. Pray for patients and family members. Pray for those in leadership. And pray for those working day to day on the front line and behind the scenes. As a church, we believe in the power of prayer, so thank you for praying. Please stay safe, help protect the NHS and save lives. And I know that I'll see many of you once the pandemic has passed.